National Cholesterol Education Month is observed during the month of September to increase awareness of our cholesterol and to educate on ways to achieve healthy cholesterol levels. Education is important as high cholesterol is asymptomatic and is one of the major risk factors for heart disease, which is the leading cause of death in the United States. Cholesterol is a waxy fat-like substance required by our bodies to make hormones. It is also a major component in cell membranes and aids in digestion. Cholesterol is produced in our bodies and can be found in some of the foods we consume. It is also carried in our bloodstream through particles called lipoproteins. There are two major types of these lipoproteins: high-density lipoprotein, which is called HDL, and low-density lipoprotein, LDL. High-density lipoproteins are often called the good cholesterol, while the low-density lipoproteins are called the bad cholesterol. When there is too much LDL cholesterol in the bloodstream, this can build up in the artery walls and can affect heart function and increase your risk of heart disease. Behaviors such as lack of physical activity, consuming an unhealthy diet, and smoking can negatively affect your cholesterol levels. Overweight or obesity, physical inactivity, unhealthy eating patterns, and excess weight can lead to high blood cholesterol. Diabetes. Type 2 diabetes can lead to an increase in LDL or bad cholesterol and a decrease in HDL or good cholesterol. Older age. As an individual ages, risk increases as the body is unable to get rid of cholesterol as efficiently. Being male, men have a tendency to have higher bad cholesterol and lower good cholesterol than women. Once women reach the age of menopause, around 55 years of age, LDL levels in women have shown to increase. A family history of heart disease or high blood cholesterol. Individuals with family members that have high blood cholesterol can have a higher risk. This increased risk could be hereditary or due to similarities in lifestyles. History of high cholesterol. Having a history of high cholesterol can increase your risk of recurrence. Since high cholesterol does not exhibit any symptoms, getting your cholesterol screened is important. According to the American Heart Association, it is recommended that adults 20 years or older with low risk should have their cholesterol and traditional risk factors checked every 4 to 6 years. The frequency of cholesterol screens should increase for individuals that have a higher cardiovascular risk. Frequency of screenings as well as overall treatment plans will vary from person to person and should be provided by your doctor and care team. While some risk factors of high cholesterol can be inherited, others can be brought about poor lifestyle behaviors. The good news is there are behavior changes that can be made to help your cholesterol levels and reduce your risk of heart disease. These changes include incorporating a healthy eating pattern, engaging in physical activity, quit smoking, and taking medications as prescribed. A healthy eating pattern can vary, but should include fruits, vegetables, grains, dairy, and protein. It should also be limited in saturated fat, trans fat, added sugars, and sodium. According to the Center for Disease Control, it is recommended that adults aim for 150 minutes per week of moderate intensity physical activity, such as a brisk walk or bike riding, and include muscle strengthening activities at least 2 days per week, such as lifting weights or resistance training. By quitting smoking, individuals can help lower their LDL or bad cholesterol and increase their HDL or good cholesterol. Lifestyle changes can help lower your cholesterol levels, but individuals often need assistance to lower their levels of cholesterol with prescription medications. These medications are important in your treatment plan and should be taken as prescribed. To discuss your risk and ensure your cholesterol levels are within normal ranges, contact your healthcare provider. Thank you for joining us today. For more health tips, you can follow me on Facebook, monica.aguirre, CEP, FCH. Goodbye.